You know, as we age, we all want to be as mobile and independent as possible. And sometimes you need a little help in the form of, joint replacement. We're talking to Dr. Andrew Alwood here at Trinity Health. Let's talk first about how someone might know that they are a candidate or they might look into getting a joint replaced.
Yeah, when you start to have joint pain or dysfunction that's affecting your quality of life, you are losing mobility and the function, can't exercise, can't do your job, then you really want to start looking into further treatments.
Okay, perfect. So let's talk about what kind of joint replacements you guys do here.
So we do robotic, which is 3D navigated by CT technology, and this involves partial knee replacements, total knee replacements, hip replacements, and even shoulder replacements.
Wow. And so let's talk about how technology plays such a key role in making this an easier procedure for a patient, for a doctor, and for recovery.
It gives us a 3D anatomy of each patient's alignment. For instance, a knee replacement, we know your hip to your ankle and every angle and size already ahead of time. So it makes the implant more accurate. It makes the joint alignment more natural. So our goal really is to give you a joint replacement that feels natural and allows you to forget that you ever had it when you're all healed up.
That's the key, right? You never had that surgery. And talk about too how those replacements themselves have changed so much. I think a long time ago they wouldn't last that long. You had to get it done again if you were younger, because I think a lot of times younger people do need these surgeries.
Absolutely. We always had age cutoffs, and we would try to get you as old as possible because we were worried they might only last 15 or 20 years. With modern technology, we feel that the bonding to your bone is better and the implants should last longer, and if everything goes well and it's put in accurately, which again the robotics helps with, then we think these could potentially last 20, 30 plus years, and we don't know where the limits are because they haven't existed that long.
Sure. Wow.
We do think they're better and better every decade.
Wonderful. So let's walk through the process of somebody, if they're coming in to get a joint replacement, what that day or days will look like.
So we evaluate the whole patient, what their lifestyle is, what their activity level is, physical exam, how stiff are you, what treatments have you had, what are our options, do we still have some non-surgical things we can try, and if not, then here are your options for joint replacement, and we walk you through the whole rehabilitation afterwards, and so you know exactly what to expect going forward.
Wonderful. And then is this like a day procedure? They're in and out in a day for the most part?
So frequently, if you have some help around the house for that first tough week after surgery, then we can get you home the same day. Some people are only in the hospital or the operating facility for a few hours. We can have you evaluated by a physical therapist afterwards to make sure you're safe, and then get you out the door and on your way to rehabilitation within a few hours.
Wonderful. All right, so if someone is dealing with pain, someone is living with this, they're like, this sounds like it can help me, what do they need to do?
They need to come in for an in-office evaluation. We need to get x-rays, we need to examine your joint, we need to discuss how much is this affecting your lifestyle. And at that point, sometimes we try injections or physical therapy. If it's more of a, hey, I've been dealing with this for 20 years, sometimes we get right into, let's get that CT scan, see your 3D alignment, and get the ball rolling on a robotic joint replacement.
Wonderful. Dr. Alwood, thank you so much for your time. We appreciate it.
Thanks for having me.
Are you